Today's video is about neck pain. Um, Lots of us have neck pain, and that's mostly because of the way we work. Most of the time, we're in front of the computer, we're looking at a mobile, and we've got our heads forward like that. And this gives us neck pain. And most people come to me with a complaint that they've got spondylitis, but it's not really spondylitis. It's more of a neck muscle spasm. And if it is neck muscle spasm that's the problem, you need to be finding ways to control the spasm of the neck muscle. And the exercises that you're taught as soon as you go to a doctor or a physiotherapist with neck pain are frankly quite pathetic, because I've taught them to my patients myself when I was starting off in this job. And I'll show you what they used to tell us to teach our patients. You'd ask the patient to push hard against their own palms with their forehead. Then you'd ask them to push hard on one side and push hard on the other side. Now, doing this just for me, who I don't have neck pain myself, but just doing this is triggering a spasm in the neck. And imagine what it would do to a person who already has neck pain. So that exercise doesn't work. And neither does the exercise of just rotating your head from side to side, because again, the neck is not happy, the muscle is spasming and it's trying to limit your movement. And what you're asked to do is go full stretch on the neck, and that doesn't work either. And so these are the two exercises that are commonly prescribed when you go to a practitioner with neck pain. And they don't work, so the person stops doing the exercise and the pain goes away by itself. But the spasm never really goes away, because that tight muscle stays tight and it doesn't really loosen itself up. The pain goes away, so you think it's okay. And then few weeks down the line, you get another bout of neck pain. And it's usually in the morning when you wake up and your neck is like that and you can't move. So this is the problem with the exercises that you're prescribed now. Now, if you look at the neck is meant to move your head around. It sounds like a very obvious statement when you hear me say it, but if you need to relieve the spasm in the neck, you need to figure out what inputs the neck is getting from which directions. So you're getting inputs from your eyes, from your nose, from your ears, through your balance, from your jaw, because that's the biggest, most powerful muscle group on the head. You're getting inputs from the shoulder, because that's another big powerful group of muscles. And the neck is situated upon the chest. And so if the chest is not situated properly, if your thoracic spine is not aligned properly, your neck has to take extra load. So if you work on all of these things simultaneously, your neck pain gets better. So if you've got a neck pain that is not responding to treatment, you have to make sure that your jaw is functioning properly. For that, you need to make sure that you don't have any temporomandibular joint dysfunction. You'll need to see a maxillofacial surgeon to check that out. So if you've got clicking in your jaw, or if your jaw dislocates, or if your jaw is frequently causing pain, then that might be a source of your neck pain. If you've got molars that are constantly infected and constantly hurting, that might be a source of your neck pain. If you have a habit of not chewing using both sides of your jaw, that might be a cause of your neck pain. So all of these you'll have to get checked by a dental surgeon who's used to dealing with TMJ issues and who's aware of the link between your TMJ and your neck pain. Now, the next thing that you need to make sure that your eyes are working properly. Now, if you've got astigmatism, basically that's a problem with the curvature of your lens. And if you've got astigmatism and if it's not corrected fully, you'll end up with a tilted head. And it might not be as obvious as I'm showing it to you, but it might be a mild tilt. And that might be there all the time. You might not be able to notice it, but that constant signal from your eye asking you to tilt your head will then cause a spasm on one side of your neck and make your neck pain worse. So you'll need to see an ophthalmologist if your neck pain is not responding to regular treatment. If you've got tinnitus, if you've got a ringing in your ears, or if you've got vertigo, dizziness when you turn your head, you'll need to see a ENT surgeon to make sure that there is nothing else dangerous going on in your ears, because that might also be a cause of neck pain that is not responding to treatment. Now, the reverse is also possible. If you've got a ringing in your ear, and if you've got dizziness that's not responding to regular ENT treatment, it might be that you've got a neck muscle spasm, and that's making things worse for you. Now you can have, now the other common problem that you get with neck is that it hurts when you move it, and that's because most people have this stooped chest posture, and if your thorax is like that, if you're bent over like that, look at what's happening. Now if I have to get my head up, see what's happening to my neck. So when you move your neck, it needs to be on a stable chest, it needs to be on an erect upright chest with your broad shoulders if it has to work properly. That's what it's been designed to do. So if you have a problem with your chest posture, you're going to have a neck pain that does not respond to treatment. If you've got a chronic shoulder instability or a chronic shoulder issue, that is also going to cause tightness in the neck muscles and make your neck pain worse. So that, again, these are things that you'll have to fix. If it's not enough if you just treat the neck. Now, when you've got severe neck pain, the instinct is for you to treat the neck. No, it's not. What's better is actually to move your shoulder. And once you move your shoulder and you get circulation improved and you start moving the fascia in this area, the neck starts to loosen up. So there are exercises in this channel for shoulder pain which you can take a look at, and you can start off with those to improve your neck pain. So that is about shoulder pain. Now, the other thing the head houses is your head, is your brain. Now, I talk about the brain because if you're anxious, if you're stressed, if you're worried about something, your head is going to move forward. It's going to move forward, and that's also going to exacerbate your neck pain. So you need to control your stress. Now, getting to the final point of the matter, what exercises can you do when you've got neck pain? There's an easy way to remember it. Yes, no, and okay. So yes is when you do this. Yes, you're nodding your head. Now you need to nod your head to a range which doesn't cause you to have pain. If you have pain that starts when you reach here, you stop at that point. You don't push past. You don't force through the pain. So if you've got a neck muscle spasm, you don't force it and you don't make it worse. So you're going to nod just a little, and you're going to, when you go down, you're going to look down. When you go up, you're going to look up with your eyes. So if you've got so much pain that you can't move your head, you can start off with just moving your eyes. Move your eyes up and down, up and down, up and down, and that's going to relax the neck muscles. You can move it side to side the way a Kathakali dancer does, and that can relax your neck muscles. Now if you're in so much pain that you're lying down, you can do that while lying down and move your eyes side to side, up and down several dozen times, and then your neck muscles will release. So the first one is a yes. Okay, when you look down and you look up and move your eyes, and when you look down, I want you to exhale, and when you look up, I want you to inhale, because the diaphragm is connected to your chest and your neck too. So exhale as you look down, inhale as you look up, and don't cause pain when you move. So that is your yes. Then there's the no. So you go from side to side. Again, move it only to a point where there is no pain. So if you've got pain when you get to this area, you stop there. Don't force it. Exhale, come back. Exhale, come back. Exhale, come back. So that is your yes, and then there's the no. And then there's the okay. This is the Indian okay. Okay. So when you don't see any other ethnicity do this. So this is the okay. So this is the last one that you'll do. Now you've done the yes, no, and okay, and only after that will you start doing circles. So it'll be probably a week after the neck muscle spasm has started and subsided that I'll ask you to do the circles. Now when you're doing the circles, I want you to make circles with your nose, and these circles need to be small to begin with, and as the pain gets better, you make bigger and bigger circles. You don't start off with a full wild circle. That is going to trigger your neck muscle spasm. So you're going to have to do it with small circles, and each time you do that, if you add the movement of your eyes to it, your neck will work better. And you go the other way also, and as your circles get bigger, your neck will start working better. Make sure that the movement is smooth and not jerky. So that jerkiness is also a sign that the spasm hasn't gone away completely. So make sure that the movements are slow and controlled and they're matching with your eyes. If you add the eye movement along with the neck pain, the pain gets better. So these are the simple exercises that you can do, and these exercises can be done throughout the day, and you need to repeatedly do them so that you reset the neck muscles and they get looser and freer and with less pain. The other thing that you need to remember is lymphatic clearance. If neck pain is a major problem for you, you need to start doing lymphatic clearance twice a day, and there's a video in this channel on how to do the lymphatic clearance. I'll put it in the links. I'll put it in the description box. So if you've got any further questions, ask them in the comments and I'll have a follow-up video on this. Thank you.